Yes, it is live.
Okay, we'll start now.
ओके सर, हम लोग शुरू कर सकते हैं.
Yes, sir. Okay. Namaskar. I am Ved Vinod Mehta. On behalf of Maharashtra University Science of Health and Mumbai Vedya Sabha, I welcome our today's guest, our esteemed speaker, Dr. Suchita Seth, our visitors, our fellow doctors, students, postgraduate students, and all the Vedyas on this platform of learning on Charak Nirupan. Our today's subject is the role of Oj in COVID-19 by Dr. Suchita Seth. And before that, we'll do Dhanvantari Vandana. Om पीयूषपाणी सकिरीट कुंडलम चतुर्भुज चारु विशाल नेत्रम सर्व नाम सुख शांतिदायनम धन्वंतरि त्वाम शीर्षा नमामः उद्भिद भीषण जलोदर भार भुग्ना शोचाम दशाम उपगताश्च्युत जीविताशाः त्वदपाद पंकज रजोमृत दिग्ध देहा मर्त्या भवन्ति मकर ध्वज तुल्य रूपाः. मृतपाय व्यक्ति को भी मकर ध्वज जैसा रूप देने वाले भगवान धन्वंतरि को नमस्कार करते हुए हम इस आज के सत्र की शुरुआत करते हैं. आज के सत्र में we have with us a very young dynamic Ayurveda practitioner, Dr. Suchita Seth. She is the master of alchemy. She did her BMS and her MD in Rasa Shastra from Kamala Devi Gauradat Mittal Ayurvedic College, Mumbai. She is associate professor of Rasa Shastra in the same college, KGMP, Mumbai. And her today's subject is very interesting, which is for the must for everybody that maybe your immunity is getting low or high, you will be very much benefited with this today's subject. And over to Dr. Suchita, madam, for your subject, COVID-19 and Ojvivaran. Thank you, madam.
Thank you very much, sir, Mumbai Vaidya Sabha and MHS for giving me opportunity to present my views on COVID-19 Ojvivaran. So, should I begin my lecture, sir?
Yes, ma'am.
Yeah. So, I'll begin with COVID. So COVID is an infectious disease which is caused by a novel virus, SARS, which is a respiratory pathogen. So the first case was recognized by World Health Organization in Wuhan, People's Republic of China on 31st December. So how does it spread? 2019. How does this coronavirus spread? So the droplet of saliva or nasal discharge of the infected person when he sneezes or coughs, the droplet spit out or he exhales the droplet, and if the person standing opposite to it have the chances of getting infection. So the droplet which he exhales out remains in the air for around 3 hours, and mask can prevent it from entering our body. The study indicates that when the sneeze expels droplet, it can reach up to 23 to 27 feet from the nose. And this virus is very small, it is very minute in nano size. So the size is approximately 50 to 200 nanometer. And 1 nanometer is 10 raised to the power minus 9, that is 1 billionth of the meter. So we all know 1 billion is 100 crore. And this virus is visualized by electron microscope. This is the one which we use to check histopathology in the pathogenesis of cancer, basically. Coming to the symptoms of COVID. So most common symptoms seen are fever, dry cough, and fatigue. The least common symptoms are loss of smell, loss of taste, nasal congestion, redness of eyes, itching, and eyes become red, throat irritation, headache, muscle and joint pain, skin rash, which should be differentiated from urticaria, diarrhea. So the severe symptoms like dyspnea or shortness of breath. So if you work a little bit also, you feel breathlessness. So this is the one, and pressure in chest. So these two symptoms, if appears, it means you need to seek medical attention, which are severe symptoms. So high degree fever. So temperature remains above 100 degree, and confusion. Confusion, you can't reach to any decision in just day to day life. So confusion is one of the severe symptoms. Few people who come in touch with positive patients, but they don't have any symptoms or they have just mild symptoms. So when you cough, approximately 3,000 droplets come out in one cough, in one go. And if you sneeze, it releases around 40,000 droplets. So what are droplets? So droplets are nothing but the water globule, and beneath it is the virus. So who is at more risk? So people above 60 years of age and those who have underlying comorbidity diseases like blood pressure, they have high blood pressure, heart problem, maybe ischemic heart disease or bypass surgery they have undergone, cancer, then diabetes mellitus, respiratory disorders like bronchial asthma and COPD, chronic obstructive pulmonary disease, obesity. So these people are more vulnerable for getting chances of infection. So how do we prevent this infection? So we need to make aware people about the preventive measures and how the virus can be transmitted slowly. So we all follow this, washing hands for 20 seconds with normal soap and water, and alcohol based rub if you're using. The content of alcohol, it should be in the form of ethanol or isopropyl alcohol, which should be 75%, more than 75%. So maintaining social distance, at least minimum 1 meter of distance should be maintained. If you're indoor, there's no ventilation, so it has to be more than 1 meter. So these are certain preventive measures. Do not touch your face. Follow respiratory etiquette. That is, I mean that if you're not carrying tissue paper or handkerchief and not wearing mask, and if you want to cough or sneeze, so you should be sneezing within inside your elbow. The place we are working, it should be quite ventilated. Doors and windows should be open. You need to wear a mask or face shield. So any fabric mask, if you are not in a risk group and you can't keep a distance, 1 meter distance, and your working area is uh, poorly ventilated, so in such case you can wear a normal fabric mask. But the people who are above 60 years of age and healthcare workers who are engaged in treating COVID positive patients, so they should be wearing either surgical or N95 mask. So this mask protects 95% of airborne viruses. So test for the COVID. So who should be given priority for COVID testing? So the people elderly and the healthcare workers who come in contact with COVID positive patient or the one with comorbidity should be given priority for testing. So if the patient is COVID positive, then he or she should be isolated, should be kept separated with toilet bath in a separate room. Now the person who is come in first contact with COVID positive patient but doesn't have any symptoms, he should be restricted for his activities and hence he should be quarantined. What do we do when we exposed to COVID? So if you don't have any symptoms and you're exposed to COVID patient somewhere in your office or working area, so you need to stay at home. Do not go for work. So you have to stay home for 14 days. Keep minimum 1 meter distance from family members and other members. Wear medical mask regularly for 14 days. Keep the room well ventilated. You should be in a separate room, and steam inhalation minimum twice you should take. So what will happen with this? So it will create unfavorable environment for viruses which enter your nose and throat for multiplication. So if the room is the small, like in Mumbai, there's a lack of space. So therein, if the positive patient is there, you have to maintain more than a meter distance between two beds. And very important thing is that you need to stay positive. All negative thoughts should not come in your mind. Do be in touch with your friends, family, friends, relatives on phone. Do exercise and meditation, which will keep your body mind cool. So, coming to the testing part, polymerase chain reaction is a molecular test. It gives you confirmation about the active infection, and the sample is collected from the throat and nose. Another test is antigen test, that is viral protein we check. The test is rapid diagnostic test. It doesn't give you any confirmation about the acute infection. The sample collection is same as that of PCR. Antibody test, this is a blood test. If you find IgM antibodies in your body, it means that you had past infection of COVID. But this it doesn't give you present current infection whether you have caught. So how long does it take to develop symptom if you have less immunity, or if you fall on above 60, or if you have some comorbidity? So once you are exposed, so within 5 to 6 days, or it can range from 1 to 14 days. So seek medical attention in case of chest pressure in chest. So there's no treatment for COVID till date. Scientists are working hard globally to find the treatment, but there's no treatment found till date. But these are the treatment therapies which are given as supportive treatment. So dexamethasone is a steroid which is used when the patient is on ventilator and to remove patient from ventilator. So increase the lifespan. To increase the lifespan, this drug is given, but this didn't prove any mortality reduction in mortality rate. So hydroxychloroquine is an anti-malarial drug, which when malarial parasites get resistant to chloroquine, they are given hydroxychloroquine. So studies at the beginning of COVID, that is in March 2019. So studies began with the study, clinical studies. The clinical trial, it showed that in some cases there was relief in patient symptoms, but then it started increasing QT interval, that is prolongation of recovery of heart's left ventricle. So even that is not good sign, and it doesn't show any antiviral effect. Remdesivir and lopinavir. So these two are used for stopping antiviral, and this is to stop replication of virus. But these two doesn't work in COVID. So if you're quite good immune, if your immunity is good, you can definitely withstand the infection of COVID. Your immunity, as per Ayurveda and my topic, so immunity can be correlated with Oja, as Oj is considered as Sara Dhatu, Sara of all seven dhatus, Rasa, Rakta, Mansa, Med, Majja. So in Acharya Sushrut in Dalhan Tika also said that Ojakshaya treatment, they said that Dhatu Vruddhikar Chikitsa, which they have mentioned Aharya Chikitsa in Bhaishajya Kalpana. It is all about Bhaishajya Kalpana. So those treatment for every Dhatu will recover Ojakshaya Lakshan. Coming to Ojvivachan, Oj is considered as stage of all seven Dhatu. It gives bulk to entire body and keeps our body healthy when it is in Prakrut Avastha. So Oj is considered by Charak Sutrastan. They have mentioned, Acharya Charak has mentioned that it is considered as Sneha part of the body in which prana resides. So as our dhatu gets nourishment by ahar ras, what we eat. So Oja also get nourishment in the same way. How does Oja is originated, or Oja Nirman? So Oja is originated in the intrauterine life of any individual. So it helps in proper union of ovum and sperms by means of its excellence, by means of its saratva. It also helps in development of primary stages of fetus in mother's womb, and it helps in differentiating various organs and systems in the body. So, if the oja or immunity of the parents, mother and father, is balwan or supreme, then the chances of getting congenital anomaly is very minimal. Coming to the function of Oja, Oja is considered as Utkrushta Sarbhag of all seven dhatus. So, as grit and honey exist in milk and flour respectively, in the same way, Oja is present in entire body and it is considered as essence of all dhatu. The Oja which stays in Rudaya is Pradhan and which we call as Par-Oj, and the quantity of Par-Oj is 8 Bindu, and the other which circulates in entire body through the 10 great vessels of the heart, that is Upper Oj, and the quantity is Ardha Anjali, that is 40 ml. So this Oja gives bulk to body. Oja originates during the fetal development at the time of conception, that is during Shukra Shonit Sanyog. Coming to Oja function, Swakarma. So here I mean karma of Oja. So Balasthapam, then Atmakarya, that is all type of movements in the living body. They are smooth and without any dysfunction or any obstruction in them, it happens. That is the function of Oja. So Swara Varana Prasadan, Sampurna Sharira Tarpan and Sharir Dharan. So Ojasthan, upper Ojasthan, it is circulated in entire body. Coming to the attributes of Oja, so color of Oja is Sarpi Varna, that is Grandha Varna, Madhura Rasatmak it is, and Laja Gandha. So the one which stays in heart, it is of Ishat Rikta and Ishat Pit. So slight reddish and slight yellowish is the color. Coming to the characteristics or properties of Oja, so it is Guru, Shita, Mrudu, Shlakshna, Bahala, Madhur Stiram, Prasanna Pischal Snigdam. So these are 10 gun of Oja, which in Prakrut Avastha, it does maintains the immunity of the body. So what are the etiology? What are the karan of Ojakshay? So Vyayam, excessive exercise or excessive work, Anshan, eating very less food, Chinta, excessive thinking, Ruksha Alpa Bhojan, Vata Atap Sevan, going out all the time in the wind and sunlight, Bhai, always scared of something, Shok, always having some worries in the mind, some tension, Ruksha Napan, Ratri Jagran, and Kapha Shonit Shukra. Okay, excessive excessive use or excessive nissaran of kapha shunit and shukra is one of the reason in ojakshaya. So here bhut upghat. So here we can consider COVID virus, coronavirus as one of the etiological reason of ojakshaya. Coming to the Lakshan, Visransa, Vyapat, and Kshay. These are three doshas of Ojak Kshay Lakshan. So, Sandhi Vishlesh, that joints feel they are getting dissociated, going away from each other. Gatranam Sadhana is feeling weakness in the extremities. Dosha Chavan, that is, dosha gets vikruta, and Kriya Sanirod. So, normal physiological functions of the organs in the bodies, they get hampered. Then Visramsa Lakshan is a Sabda Guru Gatrata. So extremities and entire body feel like stiffness, heaviness in the body. Pedal or Akshikut Shot, pedal edema, Varana Bhed. So pallor, maybe because of anemia, which is one of the symptoms seen in COVID. Glani, always feeling sleepy. Tandra, Nidra, feeling sleepy, unenthusiastic. Vyapanna Lakshan comes Murcha, that is syncope. Moho is the stage before syncope. Maunsakshay, the wasting of muscles, which is seen in Ojakshay as well as in COVID 19. Pralap is a delirium and Maran is death. So these are the Lakshan of Ojakshay. Attributes of Oja. So per Oja is located in heart, upper is in whole body. Quantity 8 drop, Ardhanjali that is 40 ml. Main function. So per Oja sustains life, helps in sustaining life, whereas upper Oja it provides strength and gives nutrition to the body. So Oja is diffused in entire body of living beings, even in energy cell. Oja is found in cellular organ of all types. So main site of OJA, we can say endoplasmic reticulum, which is in mitochondria and which is considered as storehouse of energy, due to which our body gets strength. So although OJA is present in entire body, but the main stan is Hriday. And we all know Hriday is rich in mitochondria and glycogen. So hence it provides energy for continuous functioning of heart. Research on OJA. There are many several theories and concepts mentioned by eminent acharyas, and they have given treatment also according to that. But unfortunately, we don't have any documentation to prove it. Yes, theoretical siddhanta is there. So what do we do? It is the need of an hour to validate the basic siddhanta concept or theories which are mentioned by standardizing uh, in order to maintain uniformity in quality of the formulation. So we have a compound formulation. To maintain the uniform quality, standardization should be done of the rasayan dravyas in order to prove OJ, the clinically. So clinically we can prove them in order to put forth in front of contemporary science, which will be accepted and would be beneficial for society. So life resides in OJA. Assuming all functions and properties, we may prove OJA as innate or acquired immunity. We can get it done hematologically by testing the fractions of IgM and IgG and correlate clinically. Or you can try, one can try an animal model to assess pharmacokinetic and pharmacodynamic study. So we get the above answers and we can quantify OJA, which is present in the body. So clinical trial, subjective study for the clinical trial could be possible by just making questionnaire. So we need to comprise questionnaire of the Lakshan of Prakrut OJA and give rasayan therapy, and then we just ask normal subjects to answer the questionnaire. COVID correlation in Ayurveda. Am I audible, sir? Hello?
Yes, ma'am, carry on.
Yes, sir. Thank you. So, COVID relation in Ayurveda. So, how do we correlate COVID with Ayurveda? So, Janapada Udvansa. So, Janapad, that is a large population, and Udvansa is the destruction of the life of the environment. So, the pandemic and epidemic diseases from the contemporary science are included or can be categorized under Ayurvedic concepts, which we call Janapada Udvansa. So, the disease affecting and causing damage in number of people is Janapada Udvansa, and the primary cause is Pradanya Aparat. So, knowingly, unknowingly, we do something which will harm the society and to the human life. So, what are the factors responsible? Pollution of air, water, habitat, and season. Sansarga and upasargik, that is contagious and infectious factors. And avoidable reasons is adharma, that is happening of war or shastra prabhav. Attack of demon, here COVID can be considered, and in infection also COVID can be considered as a factor, one of the factor of Janapada Udvansa Vyadhi. So Abhishap is one of the avoidable reason. Unavoidable reasons are the natural disasters like flood, storm, which we cannot stop. Coming to the treatment of Janapada Udvansa, as per Charak Viman, Acharya Charak had said Hetu Viparit Chikitsa and Vyadhi Viparit Chikitsa is to be done for Janapada Udvansa Vyadhi. The preventive measures which we can do is avoid pollution of water, environment, food, and air, avoid sinful acts and intellectual error. And very important thing in relation to COVID is rasayan therapy or rejuvenation therapy in order to enhance immunity. So basic concept of COVID with Ayurveda perspective. So COVID-19 comes under Agantuj Vyadhi. So there are two types of Vyadhi, niche Agantuj. So in Agantuj, the external factor, external reason, that is virus. So it comes in Agantuj, dosha, Vata and Kapha dosha get vitiated in COVID-19. Organs which are invaded are respiratory tract, blood vessels, kidney, and heart. So it is said that Roga Sarvati Mandagno. So Agni Mandya is the reason for all diseases. Same here in this Agni Mandya happens, and when Agni Mandya happens, arm is formed. So this arm is a toxic material which liberates toxin, and then these toxins are circulated via srotas or channels in the body, uh, which circulates nutrition, and thereby it diminishes immunity. And Dhatuvagni, after Pachakagni, Dhatuvagni of all seven dhatus get diminishes, and gradually this way it diminishes immunity in the body. So virus starts attacking vital organs and hence presents symptoms in the body and becomes fatal in comorbid individuals. So here, COVID can be correlated as kapha vata jwar. So, coming to the immediate cause, that is Sannikrishta Nidan, coronavirus, it invades kantha, that is throat, nose, and larynx, and the multiplication of virus happens in pranavasutas, that is nasa, gala, and fufus. Vipakushta Nidan, individual with comorbidity. So people with comorbidity like bronchial asthma, COPD, they have less immunity and they get infection, chances of infection, that is Vipakushta Nidan. So, what organic deformity forms in COVID-19? So, structural deformity happens in pulmonary edema and alveoli get damaged. So, the viral infection COVID-19, it damages the wall and lining of the air sacs of the alveoli of the lungs. So, as the body tries to fight it, lungs becomes more inflamed, swollen, and they fill with the mucus fluid which is present in alveoli. So this makes it harder, and hence the entry of oxygen and carbon dioxide going out, it hampers, and that's the reason pressure in chest or this feeling dyspneic is one of the fatal symptoms seem to be in COVID-19. So functional deformity is symptoms that appear in this category are like dry cough, severe fever, dyspnea, anemia, headache, and drowsiness. So above two attributes, structural deformity and functional deformity, due to Kaphavata Dushti, Rasarakta Dushti, and Agantuj Nidan, COVID can be correlated with Kaphavata Jwar. Coming to Samprapti Sanghatan, Agantuj Nidan, that is invasion of virus COVID-19, can be considered as an exogenous cause. Udbhav Sthan, that is site of origin. So multiplication of virus. So virus first attacks nose and throat. So multiplication starts happening here. Adhishtan is lungs, alveoli. These are the site of attack. Then Sanchar Sthan. So entire respiratory tract. So all the symptoms are manifested in entire respiratory tract. Vyadhistan, Vyaktistan is all pranavasrutas, which is the site of incubation, we say. Kaphavata dosha are responsible. Dusha, Rasarakta, and gradually all dhatu gets invaded as all gets vikrut as disease progresses. Pratyatmalinga, symptoms of jwara, shushka kas, and other symptoms begin. Coming to Samprapti of COVID-19. So Agantush Vyadhi, reason is SARS-CoV-2, Udbhav Sthan, nose and throat, Adhishtan is lung, alveoli, entire immune system, Sanchar Sthan, Pranavasrotas, nose, throat, and Vyakti Sthan, that is Lakshan, entire body. So in case of Ojakshaya, there are several remedies which are mentioned in Bhashyacha Kalpana. The recipe of Aharya Kalpana are used to fulfill the scarcity of individual dhatu. So patients who have Ojakshaya and they have more predominant Vatakshaya. So they desire to have Yavagu. Yavagu is one of the Kalpana in which Mudga and Tandul is taken. So it should be in 1 part, 6 times water. It has to be soaked and then boiled. So after boiling, you need to take it. So it is Vatavardhak. So patient desires Yavagu, Dhanya Hareno, that is Chana, Ruksha Laghu Ahar. In Pittakshaya patient, Til Mash Kulatha Mastu, that is water of the curd, we call, and Amla Takra. So this will, the patient with Pittakshaya will desire such sort of recipes. In Kafakshaya, patient desires Mahish Varaha mouse, good, that is jaggery, which is Guru Ahar, Guru Madhur Ahar, Abhishandi Ahar, Kshir, that is Dudh and Dadi. So this will help if such Ahar is taken by COVID patient. So wasting of muscle in COVID symptoms will be relieved. Coming to Rasaka Kshaya patient, the patient desire ಮಾಂಸರಸ್, ರಕ್ತ ಮಾಂಸರಸ್ ಯಾವಾಗೂ ಖರ್ಜೂರಾದಿ ಮಂಥ, which is sadya tarpak, and it is pitta shamak. So tarpan bruhan. So this lakshan in COVID can be minimized by taking rasakshaya treatment, which is advised in ojakshaya lakshan. So draksha dadim sneha lavana yukta, it gives prenan in weak, that is weakness in COVID symptoms. Madhu sarpi, good udak, jaggery water is advisable. In Raktakshaya patient, Rakta Siddha Mansa Sevan is advised, and Amla Dadhi Siddha Khadvak. So Khadvak is you can Dadhi Tadi Mash Sneha Yukta patient desires with Raktakshaya. So anemia, one of the cause, one of the symptom of COVID-19 will be helpful if the patient takes Rakta Siddha Mansa Sevan or Amla Dadhi Siddha Sevan. In Mansakshaya, Sthula Kravyat Mans is desired. Medakshaya, Medasiddha Gramya Anup Mansa is desired by the patient. In Asthikshaya, Mansa Macha Asthi Sneha Yukta Madhur Amla Rasadravya. And Shukra, for Shukravardhan, Kukutanda, that is hen, Mayur, Hansa, Mansras, and Gramya Anup Mansras is advised, is desired by the patient. Varcha, that is Mal. So in Malakshaya, Yavani, Yav, Jav. So Javadhanya, Shak, Mayur is, is desired. And in Mutrakshaya, so diuretics are desired, like Ikshuras, sugarcane juice, good with milk, Badarodak, Badar is bear is advisable. In Swed Kshaya, so Mardan, Nivata Shayan, and Guru Pravaranam. Artavkshay, Katu Amla Lavan, Vidahi, Guru Ahar is advisable. Coming to reverse pharmacology, so it is high time to go for reverse pharmacology and to collect data in order to validate the fundamental principles of Ayurveda without disturbing the basic concepts of Ayurveda. So Amalaki, for example, present in Chavanprash, which is the maximum good source of vitamin C. It can act as antioxidant. So generalized rasayana mentioned are like Chavanprash, Guduchi, and Amlaki. Preclinical study can be done for immunomodulators like Guduchi, Yashti Madhu, um, Amla as a free scavenging of the free radicals which are liberated by stress in the body. So there are some specific rasayana dravyas are mentioned by Acharya Charak. Kutki, it is used to increase liver enzyme, which can be used in hepatitis. Cronchbich, that is Mucina prudens, which is the treatment in Parkinson's because it contains natural methyl dopa, which is a precursor of L-dopa, and it is a source of dopamine, which helps in normal physiology of brain. Shilajit comes under, in Rasashastra, comes under Maharas. It is a good immune enhancer used in diabetes mellitus, female disorders, and disorders of urinary tract. Then Balatak semicarpus anacardium can be used as immune enhancer in autoimmune disorders. And Arjun, its prabhav is Rudya, so it can be used as a cardiac tonic. Pippali Rasayan or Vardhaman Pippali Rasayan is used in respiratory disorders like bronchial asthma or chronic rhinitis or chronic cold. But it has to be taken cautiously because it is Ushna. So if we see the nutritional assay of Chavanprash, as per daily requirement by FDA, Food Drug and Administration, it gives maximum nutrients, which I'll be showing you in the next slide. So, Guduchi, Haritaki, Amalaki, Ashwagandha, Nagbala, Gugul, Rudanti. So, these are few rasayanas mentioned by Acharya Charak. Guduchi being Vayasthapan, Vishagna, that is antitoxic, antipyretic, and it is known as Tikta Rasayan, well known Tikta Rasayan. It can be used as immune modulator, which reduces fever and it increases immunity in COVID-19 patients. Ashwagandha comes under Balya and Bruhaniya Gana. It is Katu Tikta Rasatmak, Katu Tikta Kashay, Ushna Virya, and Katu Vipak. So it has got Prithvi Mahabhut Pradhan in it. So we can use it as an immune booster and improving muscle wasting, that is Maunsa Kshaya, Maunsa Shosh in COVID-19 patients. Acharya Charak had mentioned several rasayana drugs or herbs. So Haritaki, Amalaki, Brahmarasa and Panchamul. So Panchamul here we can use it as Vedana Prashamanam. So muscle in joint and muscle pain. So that is one of the symptoms would be taken care by Panchamul, Chyawanprash. As an immune booster it can be used. Bhallatak in Amvat as auto immune modulator. Amalaki again is categorized under Vayasthapan. It is a good antioxidant and immune booster which will help in COVID-19. So Vedana Har Panchamul comes in. It is is half part of Dashamul. It relieves pain. So pain in muscle and joint can be relieved. Lohati Rasayan, many are there. I'll just take few. So Lohati Rasayan, it will increase hemoglobin count in COVID-19 patient. Loha, here Kanta Loha has been taken, which is ferric oxide, if you see the elements present in it. So ferric as oxide along with vitamin C, it fastens the absorption. Vitamin C, that is ascorbic acid present in vitamin C, fastens the absorption of iron in the body. So Lohati Rasayan has got Amla Rasatmak Dravya, which fastens the absorption. Pippali Rasayan. So Pippali is Katu Ushna Katu and Mathur Vipak. So it relieves gas. So cough is one of the symptoms in which a Pippali can be given, and it increases appetite, and this will relieve the symptoms as loss of appetite in patients. As a rasayan, Acharya Sushruta had mentioned intake of cold water, milk, honey, and ghee. Along with that, apart from that, vidanga, yashtimadu, and honey with the decoction with bhallatak and honey can be taken, or decoction of draksha with honey can increase immunity. So amalaki juice with the decoction of guduchi and honey into it will increase immunity as per Sushruta Samhita. Ashtanga Hruday, Brahma Rasayan, Chavanprash, Shila Jati. So there are so many Rasayana Dravyas, Rasayan Avleha, Rasayan Yoga are mentioned. So Charak Samhita and Sutrastan have mentioned Balya Dravya, which gives Acharya said that Balya Dravya are the one which gives strength to the body, and the one which increases Balya also indicates vitality. That is different mechanism of defensing mechanism of body, which can also be explained as Oja. So Bal can be understood Sarvadeha Bal here. So Balya Dravya mentioned here are Indri, that is Brahmi, Medhya Rasayan, Cronch Beach again in Medhya, in Parkinson, Shatavari, it's a good lactating, Mashaparni, and Payasa. Mashaparni, it will reduce pain, and Kshiravidari, again it is a Balya. So Ashwagandha, Sthira, Shalaparni, Kutki. Acharya Charak had mentioned Vidari Kanda, Pakwa Amra, Badam, Pista, Akrot, and Kukutta Mounds. So if you take this, it will strengthen body and helps relieving fatigue in COVID-19 patients. So a few rasayanas with Rasguni Vipak. So Guduchi, a Tikta rasayan, it has got Laghu, Ruksha and Snigdagun. Virya is Ushna and Vipak is Madhur. So the Prabhav is Vishapna, which can relieve patients of COVID as antipyretic, rasayana, immunomodulator, Vayasthapan stops anti-aging process, Daha Prashamanam and Prameha. So Pippali with Katuras, Laghu Ushna, Ushna Mudhur will relieve cough and Shirovirichin. So headache, where there is a headache, one can think of giving Pippali. Amalaki, except Lavanadas, all rasa are patient, present in Amalaki, and Laguruksha Gun, Virya is Sheet and Vipak is Madhur. So it comes under Vayasthapan, that is, it stops anti-aging process, means it is used as an immune booster or immune enhancer. So it is one of the Jvaragna property and Kasagna. Yashti Madhu is Madhur, Guru Snigdha, Shita Madhur. It is Vatapitta Shamak, Draksha, Madhur, Guru Snigdha. It is Kantha and Kasagna. So Rason except Lavan Ras, all rasa present in Rason. It is Snigdha, Guru and Tikta. It has got Ushnavirya and Katu Vipak. So it is Shrestha, Vata Kapha Shamak. Brahmi is Medhya Rasayan. Kashaya Tikta Ras. Laghu Guna, Sheet and Madhur, Virya and Vipak. Bala, it is Madhur Rasatmak, Laghu Snigdha Pichil. It can be used as Balya or Bruhan. It is considered categorized under Madhura Skandha, which can be used as Balya in Ojakshay patient or COVID-19 patient. So pressure in chest that could be relieved by the use of Pipali like Dravya. Shalaparani again is a Angamardahara Shothahara. So Vata Shof is one of the Lakshan which can be reduced by Shalaparani. Shilajit, it can be used as a Rasayan Balya Vajikar. Gokshur can be used as Mutral, that is diuretic. Apart from Vanaspati Dravya, there are certain Rasaushadhis mentioned in Rasa Shastra which can be used as immune booster. So Rasayan, Rasa Aushadhi itself indicates that Rasa means Kajali and they all are Rasayan. So what does Rasayan do is the associated drugs, plant herbs which are with Kajali. So it increases the action of that. So it works as a catalyst. Kajali works as an catalyst with the associated herbs. So Vasanta Kalpa like Suvarna Malini Vasanta, which contains Kharpar, one of the prime ingredient which comes under Maharas, is a good immunomodulator. So it can be used in 250 milligram of the dose twice a day with honey after food. So Madhumalini Vasant is again a compound formulation of Kharpar and it should be given 250 milligram twice a day. Shilajit categorized under Maharas, asphaltum tanginum, can be given in 250 milligram twice a day. Suvarna Bhasma. So raw Suvarna is processed, purified, and then incinerated. Suvarna Bhasma is formed. It has to be given with us. All Rasa Dravya should be given with Kashtaushadhi Churna. So Suvarna Bhasma can be done. So according to the diseases, the Kashtaushadhi Churna are given. Ashwagandha 500 milligram twice a day with honey or grit as a vehicle can be given. Balachurna 500 milligram to increase the immunity. Kantaloha, which is ferric oxide, and it will increase the hemoglobin level in patient. Abrak is one of the Shrestha Rasayan mentioned for upper respiratory tract infection. So if it is given with Trikatu or Shatti Churna, so it will help in relieving CARS. Trikatu, Dipan Pachan 250 milligram, Shati Churna 500. Rasa Sandur is a Kopi Pakva Rasayan which can be given in the 250 milligram twice a day along with Guduchi 500 milligram. So Chyawanprash can be used as an immune enhancer or the nutritional supplement for individual. So there is analytical data which was done, and basically Chyawanprash has got 36 dravya, and the maximum concentration of 5 kg is avla, amalaki, that is fresh green amla, and other 36 are in coarse form. So that comes to 1.7 kg, and this is 5 kg. So these all are processed, and avliha consistency is formed out of this decoction and uh, avla. So we have done the nutritional assay. The Chyawanprash was made as per Charak Samhita, Acharya Charak and Sharanga Samhita. The method of preparation of Chyawanprash is same. Only Acharya Charak had mentioned grit and oil too, whereas Sharanga Samhita had mentioned only grit. Oil is not mentioned till day. So we made Chyawanprash as per Charak Samhita. Um, and what we found is nutritional component. So protein, carbohydrate, fat, vitamin A, vitamin E, C, and other components are present in Chyawanprash, and we compared the dose with Food and Drug Administration, which are advised nutritions per day. So protein found in 40. So the matra of Chyawanprash is 1 से 2 pal. So one pal is 48 to 50 grams. So we have considered minimal dose. So in 40 grams of Chyawanprash, protein is 20 grams, and as per FDA, it should be 30 grams per day. 50 grams, sorry, it should be 50 grams. So we are deficient with 30. Carbohydrate contains 27, and it is 272 deficient. So it is good if you are having any metabolic disorder, diabetes or obesity. So low carbohydrate diet, so it is good for them. And fat is very negligible in Chyawanprash. I mean, it is just 0.04 gram. So it is good for patients who have high cholesterol. So in COVID-19 also, it can be given. Vitamin A is deficient by 490 and the value in Chyawanprash is 30.26. Vitamin E is 7.6 deficient with 20. Vitamin C is just 29 we have and 31 is the deficient. So this deficit can be fulfilled by daily food what we take. Calcium is 300 milligram and deficient by 700. So 1 gram is the daily dose for normal human being. Iron, we are more into iron. So Chyawanprash has got plenty of iron. So in 40 grams, 32.56 gram is the percentage of iron, and more is 14.56. So dietary fiber are same what are required daily. So why we say dietary food is advisable? Because it is laxative, and what happens is, when the patient has got higher lipids, so the lipids which are circulating in the body, so this fiber which are not digested, so they encircle the lipids and they are excreted via the feces. So this is the positive and good thing, that dietary fiber is what we require per a day. Phosphorus deficient by much 969 and magnesium 405. So the heavy metal present was not present in Chyawanprash. So lead, mercury is not present, and arsenic, it was not present in Chyawanprash, though the outsourcing was not same of the ingredients. Uh, it's an humble request to everyone, especially non-medicals who are watching. The treatment of or formulation prescribed is should be taken after consultation with your local Ayurvedic physician. As as we all know, Ayurvedic treatment is highly individualized and it depends on dosh, dusha, deshkal, prakriti, etc. Thank you everyone for patience hearing.
Yes. Thank you very much, madam.
Thank you, sir. Thank you.
It was a very explanatory and very elaborated discussion over the OJ for COVID-19 and special. You mentioned the various types to make it and the way you people are making, and regarding to Pipali Prayog and all what you mentioned is really very helpful in this today's time of COVID. So I am thankful to you, madam, and over to Dr. Vinayak Tade sir for comments. Dr. Tade sir, are you there? I request the organizing chairman of Mumbai Vaidya Sabha, Dr. Shyam Sundar Sharma sir, to please give his remarks over today's subject.
Thank you, Dr. Vinod. Dr. Suchita, you have mentioned about about during this lecture that Ojvivaran and COVID-19. So, Dr. Vinod, can you remove this slide of thank you? Dr. Suchita, she is sharing?
Yes, sir. Yeah.
Okay. So, you just
Madam,
described elaborately about this
madam, can you
Ojvivaran and
I'll stop sharing, you
COVID-19.
mean?
No, please don't share. Now remove it.
Yeah, yes. Yes,
just
sir.
click yes?
One
Fine.
thing I would like to express here that as you mentioned that this OJ comes with your birth and about that only. And one thing we should highlight that OJ, as you correlated with immunity. Immunity is not a thing which can be developed in a day, in a one day. It's a process, means the way you are living, the way you are eating, these are the things which are definitely affecting your immunity. So the Dincharya, Ritucharya and the Sadvrat, that is also important to maintain your Oz and immunity. And Bal also you have related with this Oj. complete body, means it consists carrying this bulb, and Oj is all our body. So all these good things are there. But one thing I would like to ask you, that you mentioned that Ras Aushadhi should be given, always given should be Cast Aushadhi. Can you explain about this?
So, yeah. So basically, Rasa Aushadhi comprises of a main base, that is Kajali, which is formed with Parad and Gandak. So these act as a catalyst. So whatever associated Kashaushadhi Churna we give with Kajali, that will take, Kajali will take them to the site of action. So that is the reason it should be taken with Kashaushadhi Churna. Alone, Rasaushadhi is never given.
Okay. And
Right.
you have given that slok, that Kalo Bhuto, and you correlated that with COVID-19.
Yes, sir.
So will you elaborate that thing? Because this is the time when students and all academicians, they should understand what is the COVID-19 and how we can correlate this OJ or immunity of Ayurveda and the treatment of Ayurveda. Not treatment just to prevent that or just to improve your immunity. Please elaborate about this if you can.
Sir, so Bhuta Aghat is one of the etiological factors mentioned by Acharya. So, according to me, COVID-19 is the virus which is a foreign body attacking in the body. So that could be one of the reason of Bhuta Upaghat.
Yes, yes. Thank you, ma'am. Thank you, ma'am.
Thank you.
And just summarizing your lecture, means I'm going for these cast aushadhi that you mentioned, Pipli, Amalki, Guruchi, Gokshuru, that will take care of your
Ashwagandha.
diuretic, Brahmi, it will
Yes.
take care of your mental state. So all these things you have given, and I think they can be benefited in post-COVID conditions also.
Yes, sir, definitely.
So will you say something about post-COVID?
So after COVID also, there are certain patients wherein the few symptoms like weaknesses and fever. So not recurrent fever, but weakness will recurrently happen, or loss of appetite will recurrently happen to the patient. So maybe for 3 months post COVID also, one has to follow, as you said, dinacharya, rutucharya, and proper sattvic, shadrasatmak, panchabhautik ahar should be taken along with keeping mind stress free.
Thank you, madam. Thank you very much.
So thank you very much. So on behalf of Maharashtra Science University of Health, Mumbai Vidya Sabha, we are very much thankful to our today's speaker, Dr. Suchita Shed Taide, our viewers, our guests, our technical support from MUSH, and team Mumbai Vidya Sabha are very much thankful to all of you. Hope to see you tomorrow at 3 o'clock with a very interesting lecture by Dr. Bhairavi Nimbarde. She is also an expert in Ayurveda. So let us hear tomorrow about her, about COVID and Ayurveda and Charak. So with this, we'll take your leave. And thank you very much, everybody. See you tomorrow.
Thank you, everyone. Thank you.
Thank you.
Sir, stop live and stop recording, please. Shamsir, you also co-host. You can also stop. Shamsir, you can also stop recording in live.
I'll check it. No, I can't.
Dr. Sachin sir is there? Dr. Sachin, are you there? All of us, please leave.
I have stopped it.
Yeah, very good. Now, please,
No,
everybody.
now I have stopped it.
Okay,
But
fine.
it is live. But it is live. I think we should leave this meeting.
Okay, we'll leave the meeting. Okay, chalo, bye, everybody. See you
Okay.
tomorrow.
Bye.
Everybody should leave.
Yes.
Thank you, everyone. Thank you.
थँक्यू.
थँक्यू.
I am leaving.
कॉलेज वेट करते. मी करते सोड ना.
हिंगोलीशिवाय सांगायला पाहिजे ना. हे चांगलं झालं, चांगलं. मी बघितलं कसं आपण शॉर्ट केलं ते बरं झालं की नाही. हा? हो, 50 मिनिटं बोलले तुम्ही. ते काय लोकांना माहिती असतं ते. ते भाग आपल्याला इम्पॉर्टंट नव्हतं आपलं ते. हा ना, त्याच्यामध्ये फक्त रसौषधी जी आहे ना, बेसिकली लंग्स एडिमा जो असतो ना, हा, इन्फ्लेमेटरी चेंजेस ज्या ठिकाणी होतात त्या ठिकाणी इंग्लिश